Designate an isolation room. At your healthcare provider's recommendation, create an isolation room, also known as a hot zone, for the sick person. People who are sick should not go anywhere they can spread the illness, says Paul Krupin, a retired environmental scientist who trained as an EMT and wilderness first aid responder. This means they must stay in one place in the house and avoid going into rooms that other people will use. How do you select the isolation room? Choose a comfortable room where the person can remain for the entire duration of their illness. Ideally, the room should have windows that could open to circulate air and provide natural sunlight, and a door that can shut as well, says Dr. Nanos. The door should stay closed at all times, and ideally the room should have a bathroom attached or nearby. So what happens if the infected person doesn't have access to a private bathroom? They should take extra precautions to use gloves and a face mask when using a common bathroom. Dr. Nanos says they must also close the toilet lid before flushing, because we are learning the COVID-19 virus can be spread through fecal contamination. Choose one caregiver. Someone is going to need to step up and take care of the sick family member in the hot zone. Don't draw straws. Select the healthiest person in the house who is least likely get complications from COVID-19 if infected, says Dr. Nanos. This person will be in charge of food, medicine, comfort, reassurance, changing the linens, cleaning the room, and helping with bathing and personal hygiene if necessary. If you're not sure who to designate, consult this list of people who are at the highest risk from coronavirus and make sure they avoid the patient if at all possible. It's also the caregiver's responsibility to monitor the person for worsening symptoms. The CDC says to seek immediate medical attention in the event of emergency warning signs, such as trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, and bluish lips or face. Nobody, except the caregiver, should enter the isolation room, and that includes pets. When you're sick, kisses or snuggles with your dog or cat can be quite comforting, but refrain. While the CDC is only aware of a few cases where pets were infected with COVID-19 after close contact with people, it's still wise to limit contact with pets and animals if you think you have coronavirus. Wear masks and gloves. Now, it's time to gear up properly to reduce the chances of virus transmission. Have the sick person wear a face mask and disposable gloves when other people come into their room, says Krupin. Caregivers should wear a face mask and use latex gloves when entering the room of the sick person or coming close to them with food and medications. Masks and gloves must be treated as contaminated after use and disposed of properly, although homemade face masks can be washed and reused. Disinfect the entire house. You have no way of knowing what the sick person touched prior to entering their isolation room, so it's time for a deep clean. Assume they have touched everything and disinfect all household surfaces thoroughly, says Dr. Nanos. Choose coronavirus killing cleaning products and get to work on every table, chair, doorknob, light switch, telephone, electronic device, cabinet handle, desk, countertop, toilet, sink, kitchen appliance, and anything else frequently touched in the home. The CDC offers more tips on how to disinfect hard and soft surfaces. Wash contaminated dishes, clothes, and linens. The caregiver will need to maintain a more vigilant level of cleanliness when it comes to handling anything in the sick person's room and bringing it out into shared spaces. The CDC says to handle any used dishes, glasses, and silverware with gloves before washing with soap and hot water or in a dishwasher. The CDC also recommends leaving a dedicated, lined trash can in the isolation room and using gloves when disposing of trash. When it comes time for laundering clothes, bedding and towels, use the warmest appropriate water setting and dry items completely. The good news is they don't need to be washed separately from other household laundry, but do avoid shaking the dirty laundry, as it could spread germs. Don't forget to disinfect the clothes hamper between loads. Remain vigilant about hand washing and face touching. Just as you've been hearing non-stop for weeks, washing your hands frequently remains incredibly important, and even more so with a sick person in the house. The single best defense for all of us is still frequent hand washing with regular soap and water, says Dr. Nanos. And if you don't have access to soap and water, then use an alcohol-based hand sanitizer with greater than 60% alcohol. She also says to disinfect your phone at the same time that you disinfect your hands, and to avoid touching your face or putting your phone to your face if you have not had the opportunity to disinfect your hands or your phone. Remember, you can't actually catch the virus through your hands, she says. It's when your hands touch your eyes, nose, or mouth that you have the potential to become infected. We touch our faces at least 200 times per day without noticing. Stay in isolation for at least 72 hours after symptoms are gone. If your sick family member starts to feel better, that doesn't mean you're all out of the woods yet. Isolation remains until he or she has gone 72 hours without any symptoms whatsoever, says Dr. Nanos. The medical community doesn't have a lot of information about how long you are contagious after you've had the virus. The CDC says the decision to stop home isolation should be made in consultation with your healthcare provider and state and local health departments.